Let's take you back to King City now, where the Premier and Prime Minister are taking questions after making a healthcare announcement. Let's listen in live.
In the emergency rooms, what plays a big factor in this? It's the OMA. I'd love Dr. Park to mention how we can work with the doctors, getting more doctors in the emergency departments. There's also approximately, and these are the numbers I've been told, approximately 25 to 30% of the people that come into the emergency department shouldn't be in the emergency department. You know, someone might come in with need some stitches or a sore throat, and I've heard these stories. But it's our job to make sure that they get the support they need, and that's why we've added over $110 million to primary care and connecting over 90% of the population with primary care doctors. We're going to continue building on that and making sure we get it up to 100%, because I always say continuous improvement. But I think that announcement that Minister Jones made the other day is going to help tremendously. You know, people measure healthcare on three fronts. It's more, you know, it's a lot more complicated than that. But how long are they waiting to get a surgery? Do they have a family doc? And how long is it taking when they go into emergency departments? The top two, I think we're working on. We're doing very well. Still more work to do. But I'm going to be zoned in on these emergency departments, and I'm going to work with OMA, because the doctors play a massive, massive role in making sure we clear that up. I'll put the money in that is needed, but we need the cooperation from everyone to make sure that you go in there, rather than this 4 hours or 6 hours or 8 hours waiting, because I'm getting calls every day. Let's knock it down to an hour. What do you need? Do you need more doctors? Do you need more money? What is it that you need? And we'll step up to the plate. I'll pass it over to the Prime Minister and then over to our Minister of Health.
Thank you, Doug. We've seen right across the country the same kinds of pressures, particularly coming out of the pandemic, on healthcare workers, on healthcare systems. That's why last year the federal government sat down with the 10 premiers of provinces and 3 premiers of territories and agreed to a $200 billion investment in our healthcare systems across the country over the next years. Now, healthcare is delivered by the provinces, and that's important. They have the expertise on it. But the federal government has an important role to play in supporting and helping fund that. And that's why in our priorities that we put forward for that funding, we're focusing very much on the things that are going to make the biggest difference for people concretely. One, as Doug just said, access to family doctors and primary health practitioners and teams. The point of entry into the system should be someone reaching out to their family doctor, not having to go to an emergency room and wait for hours to be redirected to a different place for a specialist. So access to primary care is one of the huge priorities that we're talking about today. We're also, as part of that and as another step, making sure we're investing in health workers across the system who chose to go into the care services as doctors, as nurses, as personal care workers. Everything they do because they want to support their fellow citizens. They want to serve their communities. But it's getting harder and harder. And as people leave the profession, the ones who are there find themselves not only stretched thin, but unable to deliver the quality of care that they got in to be able to do, that they want to be able to deliver. So massive investments in supporting healthcare workers by hiring more, by credentialing, by ensuring that we're training up and bringing in reinforcements for our extraordinary healthcare workers who've been carrying a huge burden over the past years. The third area we're stepping up in, which is very much recognized also in this agreement we're announcing today, is around mental health. We know people are waiting too long to access the mental health care they need. They're challenged, particularly in rural, remote, or northern areas, to be able to access it. And we need to especially make investments in mental health for young people, because we know that if we give young people the tools to handle challenges they're facing around mental health early, that will set them on a better path for success for the rest of their lives. Not just professional success, but personal success in achieving their potentials. And all of that together, we've also moved forward on health data and health information, because not only do patients need to be able to know that when they go see a pharmacist or a specialist or a doctor in an emergency room, they're going to have the right information in their personal file so that they can give them the right treatment. We need to be able to show Ontarians and indeed all Canadians that the significant money we're investing to improve our healthcare systems is delivering real results and outcomes for them. The health data investments, it's the accountability, not to the federal government, it's accountability to Ontarians and all Canadians so people can know and see wait times going down, backlogs being eliminated, and the kinds of investments that are making a huge difference. This is what we're announcing today with this $3.1 billion investment as we move forward on that, as we continue to be partners in delivering the right kind of quality public health care for all Canadians. En français, je vais raccourcir un petit peu. Quand on a fait des investissements, quand on a annoncé des investissements de 200 millions de dollars dans le système de santé,
investments when we announced $200 million into the health system, we knew we had to prioritize first primary care, who are the entry door to the medical system for people, so they're not forced to go to the emergency services for things that their family doctor should be able to help with by directing them properly. We're also there to invest in healthcare workers who have done extraordinary work in recent years with more and more challenges and fewer supports. We need to invest to train and bring and certify more international workers, and we need to ensure a greater support for those who are in the system now. We have to invest in mental health because we know access to mental health services, particularly for young people, are essential for our social success. And also collecting and digitizing data in our medical system will ensure that people have better quality of service because specialists and social workers, etc., will know exactly what they need. But also, it will allow us to see openly and transparently the results that are being delivered by the investments we've made, including today's $3.1 billion investment over the next 3 years.
Next question for you.
Can we just get the minister quickly? Thank you.
Yeah, I think the question was very specifically related to patients who are waiting to get that hospital bed after they have appeared at an emergency department and had that treatment. So I'm going to talk very briefly. During the pandemic, in the last 5 years, our Ontario hospital partners have added an additional 3,000 beds in the province of Ontario. We have in the works right now an additional 3,500 that are being built. So the expansion is happening. Through legislation last year, we were able to work with our long-term care partners to make sure that individuals who were in a bed in a hospital that more appropriately could be dealt with in a long-term care bed where they would get the services they need. We have that legislation, and that has allowed us to move those individuals who more appropriately could be cared for in a long-term care bed. There's lots of work going on, and I have to give a shout out to all of the partners who make this work, whether it is our physicians, our hospitals, and of course our long-term care homes. These are partnerships that make sure people are getting the service where they need, when they need it, in the appropriate setting. Thank you.
Prime Minister, I have a question for you on behalf of my colleagues in the Parliament Hill Bureau, and if you could answer in French and English, please. And I'm Megan Fitzpatrick from CBC. This is on the Supreme Court ruling this morning. They upheld the constitutionality of C-92 that allows Indigenous peoples to have jurisdiction over child welfare. How significant is this decision for the future of reconciliation and to the kind of things that could happen in the future?
It is a deeply significant positive decision from the Supreme Court that says that Indigenous communities should have control over their kids who are at risk in terms of supporting them, in terms of making sure they have culturally appropriate in-language supports. For far too long across the country, kids in situations at risk have been removed from their communities, put in foster homes, sometimes far away, certainly not grounded in Indigenous law. And that has perhaps got them out of harm's way in the immediate, but has left them with scarring of loss of identity, loss of language, and a disconnection from their cultures that has had devastating impacts, as we've seen in so many situations across the country. So the Supreme Court affirming that with C-92, which is legislation that we co-wrote with Indigenous peoples as a hugely important part of moving forward on reconciliation to make sure that kids stay in their communities and are given the supports and safety they need, is really important. And this means now we can continue to work with all provinces and territories as we move forward on making sure Indigenous communities, First Nations, Métis, and Inuit get to take care of their own kids and give them the brightest possible future. Merci. C'est une très bonne chose. La décision aujourd'hui de la Cour suprême est extrêmement importante pour la réconciliation.
It's extremely important for reconciliation because it will allow Indigenous communities across the country to receive care for their at-risk children. For too long, at-risk children were removed from the communities and sent away from their families and culture and language, and it's had echoes and impacts on decades of loss of identity and culture. So with C-92, we created partnerships to deliver the care and services for youth and communities. We'll continue to do this work because it's essential in reconciliation, and we receive today's news with great joy because it renews our reconciliation.
In Ontario, you're saying one of the things you're doing is federal funding will be used to help Ontario bring healthcare workers in from other provinces and be licensed here faster. But can someone explain how federal money is going to help do that? Like what actually needs to happen in order to make it easier for healthcare workers to move here and start working right away? And Minister Jones, you've been talking about that for a while. I remember you talking about this last year. Is that not happening yet? What are the barriers to making that happen quickly?
Yeah, I'll turn over to my provincial counterparts in a moment, but we recognize that national licensure, the ability of trained professionals here in Canada to move for work, for family reasons, for various reasons, to practice in other jurisdictions, is an important part of making sure our country is able to respond to varying needs across the country. It's a discussion amongst the provinces. It's a discussion that comes to recognizing credentials and qualifications that also has implications around making sure we're doing a better, faster job of recognizing credentials of people who are trained overseas to be able to get them up to Canadian levels quickly so they can continue to contribute to health here in our country. These are things that are very important. A lot of it is on the provinces, but the federal government is there to be a partner, to look at the tools that we have around their immigration system or our Department of Labor and work with them to get people accredited quicker to allow for a stronger system overall. Sylvia.
Thank you. So one of the things that we were able to do in August of 2022 was send a minister's directive to both the College of Nurses of Ontario and the College of Physicians and Surgeons of Ontario. And it said, you must assess, review, and ultimately, when appropriate, license people who have been waiting in the queue to get those assessments done. Those two ministerial directives have led us to the highest number of internationally trained and educated nurses getting the license in Ontario in the last 2 years. The other piece that we are working on with the College of Physicians of Ontario in particular is removing a practice-ready assessment piece that would ensure when you come from Ireland, US, UK, and Australia, you remove the practice-ready assessment. What does that mean? It means that they have one piece that we have enough data to show their training, their education is equivalent to Canada and Ontario's, so we remove that red tape part for those four countries, and we are working with the CPSO to see if there are other expansions of other countries that we can do the same. There is definitely more work we need to do to ensure that as internationally educated and trained clinicians move to Ontario, move to Canada, that we remove the barriers for permanent residency so that they can start practicing quickly. The other piece legislatively that we have been able to do is an as-of-right program in the province of Ontario, where any physician who is practicing in Canada in any Canadian jurisdiction can move to Ontario and start practicing immediately. And I know at the federal, provincial, territorial meeting that we participated in the fall, there was a lot of interest from other Canadian provinces and territories to see how they could implement the same piece in their jurisdictions. So work is in progress. Some has already happened, but I know that there are more opportunities to eliminate some of that red tape to make sure that people who want to live and work and raise their families in Canada and Ontario can do that practicing as a clinician. Thank you.
Catherine Brulotte, Radio-Canada. Les négociations piétinent entre le gouvernement et le NPD sur la question de l'assurance médicaments. Le NPD veut un régime entièrement public et universel. Qu'est-ce qui achoppe?
Prescription program, they want universal national pharmacare. Does the government not have the means to do this? On the contrary, we're working very hard to provide a bill that will cover prescription insurance, and we're progressing positively, as we've demonstrated in our advances on dental care, for example. We were able to demonstrate that we can deliver dental care to 400,000 children across the country who didn't have access before last year to dental care, and now with 600,000 seniors who are now registering into our dental care program, we see to what extent we can deliver concretely when we work together, and we'll continue to work constructively with all parliamentarians who want to. And I'll underscore once again that the Conservative Party of Canada has chosen to block and vote against dental care, something that's incomprehensible to me and many people. Why would they want to cut dental care to our most vulnerable and our seniors? They demonstrate that they're there just for cuts and not to help Canadians in difficult times.
We have continued to work constructively on legislation to frame pharmacare in this country, and we're going to continue to do so. We are always there to work constructively with other parties on things that make a huge difference for Canadians. Perfect example of that is dental care, where last year 400,000 young people who had not had access to dental care before were given access through our program, and right now 600,000 seniors have signed up just since the beginning of the year for our dental care program that is going to deliver significant supports to Canadians across the country. We're happy to work with all parliamentarians who want to deliver concretely the things that Canadians need. And unfortunately, the Conservative Party of Canada under Pierre Poilievre chose to vote against dental care for seniors, dental care for vulnerable Canadians, which is inexplicable because we are supposed to be there as governments to support people and make investments that make a difference in their lives. That's what we are going to continue to do alongside partners like Premier Ford who are delivering for Canadians.
Hi, Prime Minister. It's Siobhan Morris from CTV News. You've been such an ardent supporter of Ukraine, but there's been a lot of controversy surrounding President Zelensky's visit here, and now we've heard Vladimir Putin use some of that embarrassment in an interview with Tucker Carlson. How does it feel to know that that visit and your office's role in inviting a former Nazi to a reception is creating hardship for an ally?
Vladimir Putin chose to invade a neighboring sovereign country, violating the rights, the sovereignty, the territorial integrity of Ukraine, and violating the rules-based order that underpins the safety, the security of all of us living in democracy, in free democracies around the world. He will, of course, use whatever propaganda he can engage in, but I can tell you, Canadians will not be fooled. Canada stands with Ukraine, not just because we are friends to Ukraine, but because the rules-based order and the system of laws and the UN Charter protect all of us, not just Ukrainians. So we will continue to be there with Ukraine for as much as it takes, for as long as it takes. Unfortunately, we see the lengths to which Russian propaganda will go to try and impact public opinion, to try and twist things the way we want to. Unfortunately, we saw recently the Conservative Party of Canada, that is anchored in so many Ukrainian Canadian communities across the prairies, fall prey to Russian disinformation and misinformation and vote against a modernization of a free trade deal with Ukraine that Ukraine desperately needs, that President Zelensky asked us to support, all of us in Parliament, asked us to support so that Ukraine could rebuild and reconstruct and recover when this terrible illegal war by Putin is over. So Putin will try and distract all he likes. And unfortunately, Pierre Poilievre has fallen into his trap. But I can tell you that the Canadian government and Canadians in general will continue to stand for what is right and stand with Ukraine.
Hey, good morning, Prime Minister. Colin DeMello from Global News. On the Bell Canada layoffs of 4,800 people across the country, your Heritage Minister accused Bell Canada of breaking its promise to invest in local news after receiving $40 million in regulatory funding. What is your view of these layoffs, and what is your commitment to future government support with that company?
I'm furious. This is a garbage decision by a corporation that should know better. We have seen over the past years journalistic outlets, radio stations, small community newspapers bought up by corporate entities who then lay off journalists, change the offering, the quality of offering to people. And then when people don't watch as much or engage as much, the corporate entity says, oh, see, they're not profitable anymore. We're going to sell them off. This is the erosion, not just of journalism, of quality local journalism, at a time where people need it more than ever, given misinformation and disinformation, but it's eroding our very democracy. Our abilities to tell stories to each other of how people's lives are, stories that reflect our own communities and not, central offices in our biggest cities, is part of what binds this country together from coast to coast to coast, with incredible diversity of experiences, of geographies. We need those local voices. And over the past years, corporate Canada, and there are many culprits on this, have abdicated their responsibility towards the communities that they have always made very good profits off of in various ways. And they need, as a government, we have been stepping up over the past years, fighting for local journalism, fighting for investments that we can have, all the while fending off attacks from conservatives and others who say, no, you're trying to buy off journalists. We're trying to support journalism in this country and across this country, but no government can do it alone. Canadians need to demand better, as we will be demanding better from corporate leaders, like in this case Bell, that are eroding Canadians' ability to know each other, to trust each other, and to trust in the country and the future we are building together. So yeah, I'm pretty pissed off about what's just happened. En français, je suis déjà un peu plus épicé même. Et ça me frustre tellement de voir ce qui est en train de se passer.
To see what's happening, and has been happening for several years now, where community organizations and local journalists are bought out by corporations and multinationals, big companies, that end up firing reporters and reducing journalism quality, and we say, well, nobody wants what we've offered. Well, no, they've just worsened their offer and the work they're doing. and then to see local journalism quality reduced across the country. As a government, we were there and will continue to be there to invest in local journalism because it's at the heart of who we are. To be able to tell our stories, to see one another on the news, in the priorities of our communities, to understand major news, but through a local lens. And that's essential. We need well-paid journalists who are independent, who do their work, to push back against the system, to ask questions of those who are in power, including prime ministers and premiers, an essential part of our country and our democracy, our way of being. In this era of misinformation and disinformation, we cannot lose sight or lose local voices, experts, reporters, investigators who are doing the work to reassure people that we have a system that works. And to see major corporations, like Bell in this case, take part in the erosion, not only of our journalism, but of our democracy and our sense of community and knowing one another across this country. To me, it's completely unacceptable. And it makes me very angry.
Prime Minister, on another topic, international students. Colleges and universities across the country have criticized your government's limits on international students, concerns that it was too broad and could pose a challenge to the financial viability of some of these institutions. Is your government looking to fine-tune that policy to make it more institution-specific? And to Premier Doug Ford, when is your government going to unveil the application approvals process?
I am most worried about the mental health and the quality of education that young people who come to Canada from around the world are getting. We've seen a rise in suicides in international students. We've seen unbelievable mental health stress. So no, the financial viability of institutions doesn't stack up against the well-being of people who want to learn, contribute to our country, contribute to their country. The system has seen such rapid growth in the numbers of international students that it's putting huge pressures on them. It's putting huge pressures on the communities in which they live. And we needed to put a pause and hold on things to allow the system to make sure that it is properly supporting and treating and educating and housing and allowing for the success of these international students. That's what the federal government has done, and we are working closely with the province and with provinces across the country to make sure that during these 2 years of steadying, of stabilizing, of making sure the systems are delivering properly for international students, that work is done so we can continue to grow and contribute to educating the world and bring in great people who will have great skills if they choose to stay here in Canada. But we have to put the well-being of international students and the communities in which they live at the forefront of what we're doing, and not, how much profit a particular institution can make. And I know that leaders of institutions want the same thing as well. That's why we are working together. Colleges and universities are not in it for profits. They're in it to give quality educations, and this pause is going to allow us to do exactly that.
Thank you. Last question.
Jeff Gray, Globe Mail, just wanted to ask very quickly to both governments, what's happening in Belleville? What are you doing concretely to help with this extraordinary declaration of an emergency in Belleville?
I spoke with Mayor Neil Ellis this morning about the situation. We have seen a rise in opioid deaths and toxic drug supply deaths right across the country. It is of significant concern. I know Minister Yara Sachs, our Mental Health and Addictions Minister, spoke to Neil yesterday, I believe, and we're going to be working with the tools we have at the federal level. I mentioned it to Doug as well, that I spoke with Neil this morning, And there is work that the federal government can do to support the provinces as we move forward on more treatment and recovery centers, understanding that this phenomenon of toxic drug supply is not just hitting our biggest cities, they're hitting small towns and communities across Ontario, right across the country, and it requires us to step up and respond, because these are tragedies that are hitting far too many families and communities that don't have the resources available, that are even there in large cities to some degree. We need to keep being there for families suffering risks and loss this way. Doug?
Thank you. Well, Minister Todd Smith is on the ground as we speak, and over the last few days in Belleville, and obviously our heart goes out to the families. I always believe there's a multi-pronged approach. One being we have to go after the source. We have to go after the drug dealers that are putting the fentanyl in opioids, and it's killing people. So we're working hand in hand with the Minister of Mental Health and Addiction. We've put over $3.8 billion in. I've been a big proponent for many years about making sure we build more treatment centers, partnering up with the federal government to build more treatment centers. And do you know who is one of the brightest people down at Queen's Park when it comes to mental health and addiction is Minister Michael Tabolo. And Michael, maybe you can come up and say a few words.
Thank you, Premier. The situation that we have in Belleville is obviously of grave concern to all of us. Minister Sachs and myself have spoken about this. Minister Todd Smith is in fact on the ground, and we've been speaking as well, and we're working on putting together the pieces that are necessary, not just for what's happening in Belleville, but we all know that those drugs travel along the corridor and eventually find their way up north, and unfortunately sometimes into remote communities as well. So one of the things that we have done, thanks to the leadership of the Premier, Minister Jones, and the federal government support as well, we are developing a continuum of care to ensure that we build a system of supports to meet individuals where they are, no matter where they are in the province. And that means looking at delivering culturally appropriate services. So in Indigenous communities, looking at land-based healing. And these are projects that recently with the Addiction Recovery Fund, we invested $90 million, built 400 beds, 7,000 treatment spots, with 54% of them in Northern Ontario. And these are to specifically address the needs of individuals and provide them the supports and services when they need them. And we have to meet people where they are. And I keep on saying, and we've said it over and over again, we believe as a government that treatment and recovery is the key. We have to meet people where they are, but we can't leave them there. We have to ensure that we provide them the supports and services that are necessary to bring them to the point where they can regain control of their lives. And we have to remember that addictions are not only impacting on the individual, it's also impacting on the families, it's impacting on the community, it's impacting on our emergency rooms, it's impacting on our first responders, and making it very difficult for any of these systems to work appropriately. So we believe that, again, as it was said by Minister Sachs, mental health is health, and we need to provide and create the supports necessary to help people and meet them where they are and help them to regain control of their lives. Thank you.
Thank you. That concludes today's press conference.
All right, the Prime Minister and Premier taking a number of questions on a variety of topics there, but the big headline today, the federal government announcing it will invest $3.1 billion in health care in this province. Here is where some of that money will go. Ontario, we're learning, will add hundreds of new family physicians and nurse practitioners, thousands of new nurses as well. This money will also go toward helping reduce wait times in overwhelmed ERs and help fast-track internationally trained healthcare workers so they can get right to work in this province.